It's time for the NordCast here on WOBL, and here's your host, Nord Center CEO Don Schiffbauer.
Hey, everybody. Don Schiffbauer here again with your NordCast, and today I have the pleasure of a friend and colleague joining me from the LCADA Way. His name is Dan Haight, and he is the president and CEO, and I want to thank you again for joining us today. Our NordCast, we explore a number of topics. We've explored a number of topics over the year, from behavioral health services for child and adolescent to adults, as well as sexual assault services department, residential services. But today we're going to talk about something different, and you may have read the paper or heard out in the community that these two agencies, the Nord Center and the LCADA Way, have made the decision to join forces and merge and become a behavioral health agency that is there to treat the whole person. We're going to spend a little bit of time today during our broadcast talking about that. We'll answer some of the questions, how we got here, what we anticipate this merger doing, not just for the agencies, but more importantly for the community. I want to remind everybody that the Nord Center, we're a community mental health agency, and we right now have 5 service lines. We focus on child and adolescent, adults, sexual assault services, residential services, and crisis services. Speaking of crisis services, at the end of, towards the end of this podcast, we will talk about the new Lorain County Crisis Receiving Center, which is a partnership between the LCADA Way, the Nord Center, and the Mental Health Addiction and Recovery Services Board. And Dan and I are very excited to share with you the services that will be provided at that facility. So I'd like to take this time and introduce my friend and colleague, Dan Haight. Dan, welcome to the show.
Thank you. Thanks for having me.
Hey, excellent. Hey, listen, I know it says here, take a minute to give an overview, but I'd like you to take a little bit more than a minute and share with our listeners the services provided at LCADA Way and how long you've been around.
Sure, absolutely. So LCADA Way was founded in 1981, mainly as an addiction agency, and through the years we've kind of expanded services to include prevention and other things. But our main focus here has always been in Lorain County. We've got 6 offices. Main offices are our Women's Key Center and our Leary office for the mains portion of Lorain County. And then, of course, doing services in Erie and Huron counties. Erie County and also Cuyahoga County. Our focus has always been, obviously, substance abuse treatment. And we also serve the child and adolescent population as well with that, along with the adults. We end up using gender-specific treatment models. So you can have all females, all males, and we also have a blended group too for those who would like to have that particular option as well. One of the things that's kind of unique to us that a lot of people don't realize is we've always in our community tried to remove the barriers for treatment, and one of them that we always use is transportation and childcare. So our 16-bed facility for women allows childcare, so the women or the mother doesn't have to choose to either find babysitting and or childcare, but can bring that child with them when they receive treatment. We'll watch them while the person's there, and they don't have to worry about that. So we're always looking for ways to improve. Our prevention staff, we do a lot of prevention in our schools. We're in pretty much every single school district in Lorain County, and focus on, of course, life skills, teens, and things like that. Vaping program is huge right now. A lot of teenagers are still vaping, and we try and prevent that in the schools, educate them on the health risks there, and a partnership with Lorain County Public Health. But also, we tend to focus on other things as well, such as the problem gambling stuff that happens in our communities. Sports betting has become huge.
How has sports betting impacted the public, and are you seeing an uptick in gambling addiction or gambling problems?
Yeah, we've seen a slight uptick, certainly, since the sports betting has become available. What we tend to get referrals from, a lot of them are typically through the courts. People have run into financial issues, divorce issues, et cetera, and then problem gambling was the kind of the core basis from that. Pretty much anything addiction, think of the LCADA Way. We'll be happy to help you out.
Excellent. And I know that the LCADA Way and the Nord Center have been working closely, over the years, but more so over the last few years as we look to bring the treatment for mental health illnesses and substance use disorder illnesses together. Because I think what you and I are seeing in our respective agencies is we're taking care of the same, not only the same community, but we're taking care of some of the same clients as well. There's a high prevalence of co-occurring diagnosis between mental health and substance use disorder. And I want to call out the partnership that the LCADA Way and Nord Center had. It started about 4 years ago when we actually petitioned the Ohio Mental Health and Addiction Services to provide substance use disorder treatment in a residential setting. And we were one of the first agencies to be able to do that. And that has sparked this partnership to take on some additional characteristics as we come together for the Lorain County Crisis Receiving Center, which I promise you we will get into later. But first, we're going to take a quick break, and then when we come back, we're going to talk about how we ended up here and why we feel as though this merger and bringing these two organizations is going to benefit the community and the clients we serve. So stick around. We'll be right back.
Doctors Without Borders is delivering life-saving medical care where it's needed most in communities around the world. From bandaging war-wounded patients in Sudan to providing clean drinking water in Haiti, we're in more than 70 countries worldwide, bringing patients from sick to recovering, from emergency to aid, from crisis to care. This life-saving care is made possible by a global movement of supporters like you. Thank you.
Who are the people that serve part-time in the Ohio Army National Guard? We are your neighbors and friends. We are your sons and daughters. Our service is providing us valuable job skills, and it pays up to 100% of our tuition. We're proud to serve our state. We are your Ohio Army National Guard. Learn more about part-time service with the Ohio Army National Guard at nationalguard.com/OH. Sponsored by the Ohio Army National Guard. Aired by the Ohio Association of Broadcasters and this station.
LEAD, Law Enforcement Against Drugs and Violence, is the most rapidly growing drug and violence prevention charity in the United States. By using an evidence-based, tested, and proven effective curricula taught by law enforcement and educators, LEAD's school-based anti-drug and anti-violence program empowers children to make the right decisions about drugs, violence, alcohol, and bullying. Learn more about LEAD at leadrugs.org or follow us at We Are LEAD. Sponsored by LEAD Incorporated.
Over the last few years, things have got weird.
And for our kids, these things can be overwhelmingly stressful.
Scientific research
and real-life experience
tell us that the number one antidote to stress is authentic, trusted relationships.
So that's why I
am committed to building and maintaining a trusted space.
This is a trusted space.
Access free films and resources to build trusted spaces in your schools and communities at atrustedSpace.org.
All right, welcome back, everybody. Don Schiffbauer here as your host, and with me is my friend and colleague, Dan Haight, the president and CEO for the LCADA Way. And before we get back into our discussion, I want to remind all of you out there that are listening that have an interest in behavioral health or substance use disorder careers that you can go to both of our websites. You can go to nordcenter.org or thelcadaway.org. That would be the word the LCADAWAY.org, and you can click on careers and find out what opportunities are there for you. And I will also say this, that if you're looking for flexible schedules, both agencies have programs that offer 24/7 shifts so that it can be amenable to whatever your needs are for your family or your lifestyle. So check it out.
Yep. Also, John, we have got to mention, too, the apprenticeship programs and the additional funding that a lot of these colleges have now for people going into social work. So it's one thing that we need to continue on and promote to people coming into the field. And you can do that. We can certainly help you out if you have an interest.
That's great. And I think you're talking about the Great Minds Fellowship and the Welcome Back campaign that the Ohio Mental Health and Addiction Services is providing. So very good point. I know we've done some stuff on our social media campaign. I can only assume that you're doing the same thing. So thanks for bringing that up. All right. So, we fielded a number of questions from the community and from our staff, but I want to also just step out there and answer it for our listeners is, what led to the decision of the LCADA Way and the Nord Center merging, Dan? Now, I know I have my version. What's your version?
So the version I typically tell people is these organizations have aligned so well before, when we partnered in doing things. The Crisis Receiving Center, when we started looking at that, we figured we were going to be working together at that point. But however, when you look at what behavioral health care, when I say that, I mean SUD and mental health. When you look at that from the standpoint of functionality and need in our community, we serve over 62% of our clientele has a dual diagnosis. And I can't imagine you're probably dissimilar from what we have in terms of people coming on intake with.
And just to clarify, addiction. Dual diagnosis means?
Means somebody has a mental health and a substance abuse diagnosis. So typically, they might have alcoholism and then also have bipolar or depression or something like that as well. So, when we looked at this from a standpoint of what's going to be best for our community and our future, my standpoint was, we need to treat the person holistically. And why not have all the services under one roof to coordinate the care better?
Yeah, and I'll tell you, Dan talked about dual diagnosis, having a mental health disorder and a substance use disorder as well. But we also see that in the physical medicine space. A person with diabetes might suffer from high blood pressure. So being able to treat those illnesses with the same resources in the same space, within the same electronic medical record, because, when people need to get care either at the LCADA Way or the Nord Center, they need to, sign a release, and then that gets sent over to the Nord Center, the LCADA Way, and then they send the records via carrier pigeon. Not really very carrier pigeon, but now they'll have access to a medical record where the care teams can look in and help expedite and get the best care possible. I think for me, the reason behind the merger is exactly what you said. It's about bringing two organizations that have worked really closely together over the last several years and making sure that we're able to treat the whole person. And as we'll talk about a little later in the show, the Crisis Receiving Center really calls for these two organizations to come together, and really the purpose of the merger and bringing the two organizations together is for the client. It's a client-centered process. So, all right, the two organizations come together. What do we think the community is going to see in terms of change?
Well, right off the bat, we're still going to continue what we do today. So, I know we're going to still continue to serve people with addiction, and you're going to be serving people with mental health. The best of both worlds now is that, again, it's under one roof. In the terms of change, I think access to care is number one. People will have greater access to care for all of our services throughout the community. Whether it's at 6140 South Broadway or at 120 East Avenue in Elyria, et cetera, these people won't have to travel as far. Will have immediate access to care into our system, and be able to make those referrals right away to all the vast majority of services we have to offer from both of our facilities.
And one of the services that the LCADA Way provides is transportation. We know that our community has opportunity for improved transportation. Some of the clients that we're serving don't necessarily have reliable means for transportation. Can you talk a little bit about your transportation department and the services they provide?
Yeah, absolutely. So what we do for transportation, again, as I mentioned earlier, it's again removing that barrier to treatment. LCAT does an okay job, but they're usually dropping off, several blocks away, and somebody has to be on that bus for, an hour before they get to their endpoint. What we provide with the 12 vans that we run is typically from your door to our facility. So there's no stopping in between. We may pick up another 8 to 9 people along that way. However, we route them based on that. And over the last several years, it's been a great success, great compliment to us in terms of from our clientele, because people try to use the provider rides and things like that and have to wait around, and they're not necessarily proactive, I guess, in terms of that to be able to do that, because the person has to call 48 hours ahead of time for that stuff. So anyway, our transportation program, typically every year, we run actually more miles than I've seen LCT publish in their thing. So we have, again, 12 vans that run constantly through Lorain County.
That's great. And well, I know we're looking forward to being able to utilize that service for the clients that we're serving as well. What I want to talk about now is how to, you've talked a lot about access and decreasing barriers. And I think for some of those barriers can be how we access services. We've talked a lot on this program about how you can access mental health services at the Nord Center. How does one go about accessing services at the LCADA Way?
Well, probably very similar to what you do at the Nord Center today. We have a phone number you can call. It's 440-989-4900, option 2. From there, basically, you're told, hey, come in tomorrow morning at 10 a.m. We have a walk-in for you. We have availability for telehealth as well. So Monday through Friday, there's an availability for you to walk into one of our facilities and or do a telehealth assessment via video or phone call if you need to.
All right. Well, and you already beat me to the question about telehealth services. So with that, we're going to take a quick break, and then we will come back and we will dive into, we're bringing two agencies together. What are we going to call it? And then we're going to talk to you about the Crisis Receiving Center. So stick around and we'll be right back.
There's danger out there. It lurks on highways and quiet neighborhood streets. It's more likely to kill you than a shark, and more terrifying than the biggest snake. Distracted driving claims lives every day. Every notification, swipe, social post, video, or selfie while driving risks your life. So while you might think public speaking or the zombie apocalypse is scary, what's really terrifying and even deadly is distracted driving. Eyes forward. Don't drive distracted. Brought to you by NHTSA and the Ad Council.
When it comes to a gun suicide attempt, all it takes is a moment.
Heather and I had an argument just like any other couple. I was lost. I had snapped. I had a gun, and I was going to take my own life. Heather helped me realize that there was still a life to live for the better of myself, my family. My weapon is now safely put away.
A moment of crisis can happen to anyone. Store your guns, locked, unloaded, and away from ammo. Hear more safe stories at endfamilyfire.org. Brought to you by Brady and the Ad Council.
The key to unlock the next breakthrough in cancer research could be sitting in your driveway. Stand Up to Cancer's vehicle donation program makes it easy to turn your unwanted vehicle into funding to support innovative cancer research. So when you're looking to get rid of your old car, truck, motorcycle, RV, or boat, why not donate it to Stand Up to Cancer? You can be a driving force in cancer research. Donate your car today. Visit standuptocancer.org/cars to learn more.
Doctors Without Borders is delivering life-saving medical care where it's needed most in communities around the world. From bandaging war-wounded patients in Sudan to providing clean drinking water in Haiti, we're in more than 70 countries worldwide, bringing patients from sick to recovering, from emergency to aid, from crisis to care. This life-saving care is made possible by a global movement of supporters like you. Thank you.
All right, everybody, we're back again. Don Schiffbauer here as your host, and I have with me my friend and colleague, Dan Haight, the president and CEO of the LCADA Way. So we've talked a lot about how these two agencies have worked together over the last many years, but really closely over the last several years. Mm-hmm. You have two agencies that have a strong presence both in service and in name within the community. But I think I read in the article where these two organizations, when they're coming together, they're going to come together under a new name and a new brand. Is that correct?
That is correct.
All right. What's the rationale behind that?
So, obviously, one of the things that we want to make sure is we're never going to forget the Nord Center's past and LCADA Way's past. There's a big a lot of things that have happened in the community in Lorain County that we should be proud of. So the reason for the new name is really to come out and say these two are merging as equals. We are looking forward to this, to come out into the community and have a brand new image, a brand new name.
Mm-hmm. And I think with that brand new image and name also comes a care delivery model that is somewhat foreign to behavioral health. And when we say behavioral health, we're talking about mental health and substance use disorder, because historically these two diseases have been treated in silos. Right. And that is not characteristic of other illnesses. You don't get your diabetes care on one hospital floor and then get transferred to another floor for your high blood pressure care. You get treated in the same space with the same nurses, same physicians. And what we're going to be doing here is we're going to be creating a care delivery model that is designed to have the client or patient at the center of that. And it's one that breaks down silos. And it's important that that new care delivery model be associated with a new name and a new brand. So for those of you that are waiting for the big cliffhanger, like what's the new name? We don't know yet. We're actually bringing the agencies together along with some community members to come up with what that new name and brand is. So stay tuned. More to come on that in the upcoming months. Dan, we've talked about on this show some misconceptions and stigma associated with behavioral health. What are some misconceptions about the treatment for substance use disorder that you've heard during your career that you'd like to take an opportunity and say, hey, completely off base, not true?
Yeah, number one is always just tell them to stop. Person just to go ahead and, why don't they just stop drinking or stop doing drugs or whatever. And people really need to realize that addiction is a disease. It's a brain disease that, it's not that easy to just tell somebody to stop. Now, are there people out there that have done it before? Absolutely. I'm not saying it can't be done. But what I'm telling you is that LCADA Way will help you perform those behavioral health changes. We may use medications to help you overcome those addictions for a short period of time. So the misconception that just stop right now doesn't always work. And everybody has their own recovery. So, you may recover differently than I would recover. Same thing if we had a surgery. I mean, you may recover a different path than I would. Mm-hmm. And that's the same concept we have here. Everybody has their own plan. It's individualized to meet that person.
That's a really good point. You talked about the use of medications, and I think sometimes people associate the use of medications to assist with a substance use disorder or a mental health illness as a crutch. But think about how many people are out there on a blood pressure medication or a diabetic medication. We don't think twice about utilizing those medicines to help with those illnesses. And the same thing should be said for behavioral health, both mental health and substance use disorder. We're going to talk about the Crisis Receiving Center in the next segment. But, before we go to that next segment, is there one thing that you would like the general public to know about the LCADA Way that you think is either unknown or a misperception?
Oh, wow. You caught me on that one. I would say that the misconception is the fact that, that people who come to our center are using. So when we move into a community, a lot of times people are like, well, we don't want, this person here because they're going to be druggies all around us. It's so far from the truth. That they avoid us. They know we can sniff out, anybody using in the parking lot, and we drug test constantly. So people that are coming to our facilities are sober, aren't dealing drugs, et cetera. So just another stigma aspect to what we do.
Yeah, and I think for us, if I were to answer that question for the Nord Center, I think just like the LCADA Way, even though we're taking care of some of the community's most vulnerable, that our services are evidence-based, state-of-the-art, and are appropriate for all members of our community. We take Medicaid, Medicare, commercial insurance, and even if you don't have insurance or the means to pay, the same holds true for the LCADA Way, that regardless of your ability to pay, you can get services at our agency, and that's true for LCADA, right?
Correct.
Yeah, because we want to try and remove barriers that contribute to people not accessing care. Speaking of accessing care, we're going to take a quick break, and then we're going to come back and talk about the community's new, I will say it will revolutionize the way people have access to behavioral health care, and that's the Lorain County Crisis Receiving Center. So stick around, and we'll be right back.
Who are the people that serve part-time in the Ohio Army National Guard? We are your neighbors and friends. We are your sons and daughters. Our service is providing us valuable job skills, and it pays up to 100% of our tuition. We're proud to serve our state. We are your Ohio Army National Guard. Learn more about part-time service with the Ohio Army National Guard at nationalguard.com/OH. Sponsored by the Ohio Army National Guard. Aired by the Ohio Association of Broadcasters and this station.
LEAD, Law Enforcement Against Drugs and Violence, is the most rapidly growing drug and violence prevention charity in the United States. By using an evidence-based, tested, and proven effective curricula taught by law enforcement and educators, LEAD's school-based anti-drug and anti-violence program empowers children to make the right decisions about drugs, violence, alcohol, and bullying. Learn more about LEAD at leadrugs.org or follow us at We Are LEAD. Sponsored by LEAD Incorporated.
Over the last few years, things have got weird.
And for our kids, these things can be overwhelmingly stressful.
Scientific research
and real-life experience
tell us that the number one antidote to stress is authentic, trusted relationships.
So that's why I am committed to building and maintaining a trusted space.
This is a trusted space.
Access free films and resources to build trusted spaces in your schools and communities at atrustedSpace.org.
There's danger out there. It lurks on highways and quiet neighborhood streets. It's more likely to kill you than a shark and more terrifying than the biggest snake. Distracted driving claims lives every day. Every notification, swipe, social post, video, or selfie while driving risks your life. So while you might think public speaking or the zombie apocalypse is scary, what's really terrifying and even deadly is distracted driving. Eyes forward. Don't drive distracted. Brought to you by NHTSA and the Ad Council.
Welcome back, everybody, and we've got about 6 minutes left in our program, and with those 6 minutes, we're going to fill it with information regarding the Lorain County Crisis Receiving Center. And before I turn it over to Dan Haight, the president and CEO of the LCADA Way, the Lorain County Crisis Receiving Center is a building that is being built at 6130, which is at the exit of Middle Ridge and Route 2, just north of the current Nord Center building. It's a 30,000 square foot building. It'll consist of 2 floors. On the first floor will be a behavioral health and substance use disorder receiving center, almost like an emergency room for behavioral health, for the people experiencing a behavioral health issue. There will be the capacity to take care of 16 people at a time. It will be staffed with nurse practitioners, physician's assistants, nurses, counselors, case managers. But probably one of the most important roles in that setting will be peer support specialists, people with lived experience that can work with clients coming through the door and form a relationship with them to help get them access to the treatment that they need. And then there are some exciting services going on the second floor, and Dan is going to talk about those and why we need more of them.
Absolutely. So the second floor will be a 16-bed detox unit. So obviously, as they come in through the first floor, if you need addiction issues for detox, they're going to send you straight up to the second floor. There you'll spend roughly 5 days on average going through a detox portion of that. From there, the whole beauty of this project is coordination of care. So we're going to coordinate that care so you get to the next step. So whether that's a sober living home, maybe back home, depending on your living situation. But the reason we need this so bad is because we send out over 700 people a year to detox places that are outside of Lorain County.
And we talked about transportation. It's not like there's an easy way to get to those places.
Absolutely.
Either.
Yeah, so I mean, that amongst the fact that, again, going to the right place to get your behavioral health emergency taken care of. So whether that's medication or whatever it might be, we're going to be partnering with and doing this. The biggest, beauty is, again, the coordination of care to get to where they're going to go next. I mean, I can't say enough about that, how this is going to be. So, yeah. Don, I mean, you've worked in the ER. What would you say? I mean, explain that.
Yeah, so very good point. I just want to call out that our emergency rooms, and we've got 4 of them in Lorain County. They do an exceptional job of taking care of anybody that walks through that door. But we also know that people experiencing a behavioral health or substance use disorder emergency need more than the care that they're getting there. And what they can do is they can come to the Crisis Receiving Center and have access to quick counseling, medication stabilization, or appropriate assessment and disposition to the right level of care. No doubt the ERs are doing everything they can to provide the necessary care for this client population, but there's a way to do it better. And not only will it be better for clients, but it also will serve to help, decompress some of the emergency rooms. But also, we know that a lot of people that are experiencing a behavioral health or substance use disorder emergency go to the ER. If they're not going to the ER, they're going where else?
Right.
Jail. And so having a place where law enforcement, fire, and EMS can drop off and be able to hand off that person to a skilled clinician and then get back to their municipality to get into service will be important. So we got about a minute or so left. So when you talk about detox, are we talking about alcohol detox? Are we talking about chemical detox?
So it's going to be all levels. So when somebody has alcoholism, they can come into the center as well. If they're coming off of an opiate, whether it's heroin, fentanyl, whatever it may be, we can help that as well. So I won't bore you with the ASAM levels of care, but basically, if you have an addiction issue and you want to have
That's
detox.
American Society of Addiction Medicine, people.
This is true. The standard listener probably is like, what does that even mean? But anyway, that really puts us into what phase and what level of care you need. It's an individualized approach with that. But yes, if any particular detox issues you have and you want to get off of drugs or alcohol, we will help.
Yep. So sounds like an awesome building. Sounds like great service. When's it going to be available?
Well, unfortunately, not for 17 more months.
Yeah, so we're probably looking at June or July of 2025.
Yeah.
But Dan and I will be taking an opportunity as that comes to fruition. And I just want to make mention that, you're hearing from the Nord Center and the LCADA Way. It involves a number of community partners, and I would be remiss if I didn't call out the Mental Health Addiction and Recovery Services Board, who have put together some significant resources to get this building constructed. And we're really looking forward to partnering with not only them and the LCADA Way, but other agencies across the community to provide this revolutionary service. Well, we are almost at time, and I want to take this opportunity to thank my colleague, Dan Haight, from the President and CEO for the LCADA Way. I hope you enjoyed hearing about the details behind the merger and the why. I hope you learned a little bit more about the services being provided at the Nord Center and LCADA Way, and an agency to be named in the future. But if you have any questions about the information presented, or if you are looking to seek services, there are a number of ways you can access. You can go to our website, www.nordcenter.org, or www.thelacadaway.org. If you're experiencing a behavioral health or substance use disorder emergency crisis, all you got to do is dial 988, and that'll get you connected to a call center where we can get you connected with the resources that you need. So, Dan, once again, thank you very much. To all of you, thank you for listening, and have a great day.
The proceeding was a paid informational program. The views and opinions expressed were not necessarily those of the staff, management, or advertisers of WOBL Radio.
1320